Hello, my name's Simon Thompson. I'm an orthopaedic knee surgeon. I practice in London and across Surrey. When a patient sustains a soft tissue knee injury, there's normally pain and swelling. This sometimes can be accompanied by cracking or creaking or audible pops in the knee. A painful swollen knee is a sign that it should be looked at and investigated. If there are audible pops, this may well indicate that there is a ligament injury or a cartilage damage. With regards to soft tissue knee injuries, if there is a delay to presentation or there's been an inappropriate delay to referral, there can be disadvantages to the patient in the long term. If a knee is painful and swollen, then I would suggest an onward referral to myself for a review as a matter of urgency. Treatment for soft tissue knee injuries at home normally involves rest, ice, compression, and elevation. This is known as RICE. If there is a delay to presentation or things fail to settle with regards to the knee, I would always recommend a referral to a physiotherapist via the general practitioner or referral to myself for evaluation. Any unnecessary delay in a significant soft tissue knee injury can be disadvantageous to the patient. On evaluation of a soft tissue knee injury, the important parts of the history and the examination. These will reveal a lot about the nature of the injury and whether there is a requirement for imaging, either X-rays, MRI scan or CT scans. These will then determine the onward management of the injury and whether non-operative management can be followed or surgery is indicated. Surgery should always be the last option and the correct option. The majority of soft tissue knee injuries can heal themselves as long as they're supervised appropriately either by a physiotherapist or an orthopaedic specialist like myself. If a knee injury fails to settle, then there is a potential role for surgical intervention, and the real art in surgery is learning when not to operate and when surgery is indicated.